Welcome to our educational video about urodynamic testing. If your doctor has recommended this test, you are probably wondering what it's all about. Don't worry, we are here to explain everything in simple terms. So what exactly is urodynamic testing? Well, it's a way for your doctors to check how your bladder is working. It helps them understand how you store and release urine, which is crucial for deciding the best treatment for you. Now let's talk about preparing for the test. The good news, there's not much you need to do. Please stop any bladder control medications 1 week before your testing day. No other medication changes are needed. On the day of your test, try to arrive with a fairly full bladder. Oh, and avoid using the bathroom for an hour before your appointment. When you arrive at the clinic, a friendly nurse will greet you and explain everything. They'll answer any questions you have and ask you to fill out some forms. You'll even have a chance to watch this video again if you'd like a refresher. Alright, now let's walk through the test itself. Don't worry, we'll take it step by step. First, you'll be asked to undress from the waist down and cover up with a sheet. Then, you'll pee into a special funnel-like toilet. This helps measure how much urine you have and how fast it comes out. Next, the provider will use a thin tube called a catheter to drain any leftover urine from your bladder. It may feel a bit uncomfortable, but it's over quickly. Try to take some deep breaths to help you relax. The provider will gently insert 2 thin tubes, one into your bladder and one into your vagina. These tubes are known as catheters and are very thin, similar in size to thin spaghetti pasta. The catheters are long, but this is to reach the urodynamic testing machine. Only a very small portion is used for the bladder. This is the urodynamics testing machine. Your provider will use this machine to slowly fill your bladder with water, simulating the bladder filling with urine. During this filling, your provider will ask you to notify them of a few things. When you first feel the water entering your bladder, when you feel a slight urge to void, when you feel an urge to void enough that you would start walking towards a restroom, and finally, when the urge is so strong it feels as if you could no longer hold any more urine. At certain points during the filling phase, your provider will ask you to cough a few times as well as bear down. It's completely okay if you leak during this portion. Remember, that is what the test is assessing. And that's it. You're all done. They'll ask you to pee into the funnel again, this time with the thin tubes still in place. You'll get dressed and answer a few more questions. You might feel a bit sore afterwards, but drinking lots of water usually helps. If it still hurts or burns when you pee after 24 hours, make sure to call your doctor. Remember, this test helps your doctor understand your bladder better so they can give you the right treatment. Thank you for watching. We look forward to working together with you in your upcoming urodynamic testing.